Hello, good day, colleagues and instructor. This week's discussion is about headlines about our health. So, within this short video, I'm just going to explain some of the digital college clippings that I helped to put together of headlines occurring in my own community. And this week's discussion is basically about social determinants of health. And I'm going to also look at some of the differences or some of the differences or distinguish between social and structural determinants of health in Ghana. That is what we're going to look at. Basically, also look at some of the effects that it has on the population or the people. So from our screen, you can see my heading to be health in headlines. What does health itself even mean in the beginning? Health itself means that a state of complete mental, physical, social well-being, and not just the absence of infirmity or diseases. So that is basically what it means. And from our screen, we can see that I've also jotted down that recent news headlines reveal how education, housing, economic policies, and nutrition shape health outcomes. So each story here is a window into the forces that determine who thrives or who is left behind in the society. So looking closer into the pictures, you can see some of the things here. We have school closure in Ghana, that is a barrier to learning and health, which is one of it. And also when you move also for you also can see one of the things here, which is also published by Ghanaian Times, which is a government implement new housing policy to address urban slum conditions. When you also move down, you can also see that economic policies fail to address youth unemployment in Ghana. When you also move on, you can also see a lot of them. You also see rising malnutrition rates among children in Ghana and many more. So later by later, we're going to take our time to explain them one by one. These are the places that we had these headlines from. One of them is Ghana Web, which we had it from a 2022 publication. We also have the Ghanaian Times 2023 publication, BBC News also from the 2023 publications. So basically that is what we're going to be looking at this day. So let us continue to see. So let us first explain what social determinant itself means. Social determinant of health, what does it mean? So social determinant of health is just a condition in which an individual is born, the individual grows, the individual works, and the individual age. So that is basically the social determinants, and they include education and literacy, and also housing and sanitation, employment and income, access to health care, and also food security and nutrition. These factors, which mean the social determinants of health, shaped by policy and economic system, determine the health outcome far more than medical care alone. So social determinants indeed actually shapes the health outcomes of individual more than medical conditions or medical care. So for the first headline that you can see on the screen, I'm going to talk about is school closure in Ghana. And this thing actually happened in 2020, but you see it was published in 2022 by Ghana Web and how it affects health. So 2020, that's when this thing happened, when COVID was actually rampant in Ghana. So the government took this initiative to help tame the spread of the diseases. So in Ghana, we termed it as lockdown. That was exactly what happened. So from the headline, it said school closure in Ghana, a barrier to learning and health. And that was by Ghana Web in 2022. Moving fast forward, we also look at what the headline actually talks about. The headline here says that extended school closure during the COVID widens educational inequality and children from low income household lack access to online learning, which is very true because you don't have much money to afford the gadgets and also even the data to do that. So they fall behind and face higher dropout rates. They drop out from school. And why does this thing actually matter? Why is it a health concern? Because without strong education, young people get access to limited jobs, prospect, and also they get lower income and they fall greater vulnerability to poor health. And if this is not well taken care of, it becomes a cycle that spans around their generation. Moving fast forward, we also look at the difference between the structural and social determinants of health. So basically, we see that with the structural, this includes the government policies, the economic systems, the legal frameworks, and the institutional rules. And also look at the social determinants. It also talks about education, housing, employment, healthcare access, and nutrition. And all these ones put together also move on to improve the individual health outcomes depending on how it is being held or it's being operated. So that is basically what we can talk about the structural and social determinants. Moving fast forward, we also look at another policy, which was a government policy to implement new housing policy to address urban slum conditions. We know housing is also a structural determinant which actually affects the health of humans. So if it is in a poor condition, it can actually affect the health of the individuals in that vicinity. So the government decided now to implement a new housing policy. So government housing policy is a strategy, which I said initially is true. Urban slums lacking clean water, sanitation are also social determinants that directly increase disease risk. So improving the housing infrastructure is one of the most powerful ways to reduce communicable diseases burden in densely populated areas. So that's basically what why it matters. Now let's look at another thing. We also have another headline which also says that economic policy failed to address youth unemployment in Ghana, and this was published by Joy News in 2023. So let's look at it into the structural form. So it's an economic policy, which is a structural determinant, as we saw in the previous slide, shapes job availability. When this policy fails, youth unemployment rises. So youth unemployment is a social determinant, as we saw in the previous slide, that employment and income or incentive. So that's what we saw. So limited access to healthcare, nutritious food, and stable housing, because you don't have a stable income, so there's no way you can have a stable housing. So unemployment is not just an economic issue, but it is also a public health crisis that perpetuates poverty and poor health outcomes. So moving on, you can also see another headline which we read in the overview, that we have rising malnutrition rates among children in Ghana, which was published by BBC in the year 2023. What are some of the short-term effects? So children from low-income communities faces, when they have poor nutrition, they face stunted growth, weakened immunity, and also developmental delay due to inadequate nutrition. And also, what are some of the long-term consequences that they can face? That is, they can malnourished children are at a higher risk of chronic disease when they become adults, perpetuating a cycle of poverty that is going to move around them across their generation. So, without much ado, we also look at some of the ripple effects of health inequity. So we have school closure, dropouts, limited employment, poverty, and poor health. That is what is there. When we look at unemployment, we come to the policy failure, the joblessness, no healthcare access, and so worsening outcomes. So that is what you saw, and also you have mapped it through to see. When it comes to the housing crisis, it comes to slum conditions, contaminated water, disease, when it comes to chronic illness. When it comes to malnutrition, it also comes to food insecurity, stunting or stunted growth, chronic diseases, and intergenerational poverty. So these are some of the headlines that we picked and what they actually affect them or what it leads to. That is what we're actually seeing here. So each determinant reinforces the others, creating a web of disadvantages that is difficult to escape without systemic intervention. So that is basically what we are looking at. So when you move on, that is basically what you are going to see down here. Sorry, but I think that's what you're going to do now. So that is what exactly what you're going to see from this time onwards. So as you move on, we also look at the next thing to see down here. So now let's look at the next thing here. So strategies that we can actually use to change things out here. So we have to strengthen the educational access. So we have to invest in digital infrastructure and community learning centers to prevent future disruption for closing the classrooms door on vulnerable children. So we have to reform our housing policy like the government of Ghana try to do. So we have to expand urban slums, upgrading program with clean water, sanitation, and safe shelter as foundational public health infrastructure. And so we also need to look at and address the youth unemployment. So you have to design an economic policy that creates meaningful job pathways, linking employment program to health care access and social protection. And also we have to also, as public health, we have to force and also fight our way through to combat malnutrition. So we need to scale up community nutrition programs, school feeding initiatives, and subsidize health care for low income families. So that is basically what we are looking at. And last thing, so in the summary, this is what we need to look at. So here we saw that each news story that we examined to reveal a real world determinant shaping health outcomes for millions of Ghanaians. And so look at the structural shapes in society. The policies and economic system are not neutral. They actively create or reduce health inequalities like we saw when we did the mapping up in the previous slides. So also look at equity requires action. So if you want to have equity, then you have to put in better action. So here you can see that they said effective public health strategies must address root causes, not just symptoms, to break the cycle of disadvantage. So basically about this presentation and about this topic, if you understand the social and the structural determinants of health, that is indeed the first step towards building a more equitable society. For instance, Ghana, from where I come from. So that is basically what we're talking about. So this is where we actually got our stories from. What is the sources? So we have some from BBC News, like we said, and now this is what we picked from the rising malnutrition among children in Ghana. We saw that one. We also saw the school closure, which was also from Ghana Web. We also saw government implement new housing policy, so from Ghanaian Times. We also saw economic policies fail to address youth unemployment, which was from Joy News, and we also saw social determinants of health, which we distinguish between them, and also saw what are social determinants of health. So, and also below are also the links that we can follow to also to read more about whatever I presented today. Thank you for your time and also your attention.